Generally, people have their own fears about angiography and angioplasty procedures due to prejudices and lack of information. Hello friends, I am Dr. Madhur Jain, consultant interventional cardiologist. Today, I am going to tell you about these procedures. Angiography and angioplasty are two different medical procedures that are related to blood vessels. Angiography is just a test or a diagnostic procedure which is used to investigate or examine your blood vessels for a potential heart condition or, to be precise, any blockage in your blood vessel. If angiography test shows narrow blood vessels, angioplasty procedure is done. Angioplasty is a form of treatment in which narrowed arteries are widened to treat the condition. So, angioplasty is a therapeutic procedure. Now, after this brief introduction, I am going to tell you in detail about these procedures. So, what is angiography? As I told, angiography is the process of examining arterial blood vessels to check for any potential blockage in the blood circulation. During angiography, a special dye called contrast medium is injected through a fine tube or catheter which enter into the body through the arteries of groin or wrist, and X-rays are immediately taken. This highlights any potential problem or blockage in the blood vessels, and accordingly, further course of action or treatment is decided by us doctors. Angiography may be considered in the following situations: when you have chest pain or angina, to detect narrowing of arteries that can lead to stroke or heart attack, to identify peripheral arterial disease where the blood supply to the hands or legs is restricted and you may have pain on walking, or later on gangrene can also occur, to diagnose blockage in the blood supply to the kidneys, lungs or the brain, and to plan invasive procedure for widening of blocked or narrowing blood vessels. Now, what is angioplasty? As I told, if angiography test detects blockage in your artery, your doctor may advise treatment by an angioplasty procedure in order to avoid major surgery like bypass surgery. Here again, the catheter or tiny tube is inserted through the arterial blockage, and then a wire is crossed across the blocked site, and then a special balloon is taken over the wire, and that is inflated at the site, which thus relieves the blockage and allow more blood to flow through. This balloon is then deflated and withdrawn back. This is commonly known as balloon angioplasty. After that, most of the times, doctor also place a stent at the same site within the artery to keep them open for a longer time. Stents basically are wire mesh metal that is sometimes coated with specific medication to keep the artery open for a longer time. Remember, if you found to have multiple arterial blockages on angiography, or you have any other health condition like diabetes, or have a low pumping capacity of the heart, that means heart failure condition, you may be advised to go for a coronary artery bypass surgery instead of angioplasty. In bypass surgery, a blood vessel from another part of your body is used to bypass the blocked site of your artery. Now, a few points about the safety and duration of both the procedures. Both angiography and angioplasty are generally safe and painless procedures that can take about 30 minutes to 2 hours independently. General anesthesia is not given in both the procedures. That means we don't render you unconscious. Only local anesthesia is given. That means only that part of the wrist or groin is numbed down from where the catheter or tube will be inserted. In some cases, mild sedation may be required. There are few risks associated with them which you should be aware of. It's common to notice some bruising or soreness at the site of entry of catheter or tiny tube in the groin or wrist for a week or two after these procedures. Rare complications such as severe allergy to dye, dizziness, shortness of breath, stroke or kidney damage or internal bleeding can also occur. But these are definitely rare. And most of the times, if they occur, they are temporary and can be treated. Specifically, after angioplasty, there may be some rare complications like re-narrowing of artery or restenosis, which mostly occur when only balloon is used for angioplasty and stents are not placed. A severely narrow passage that is impossible to maneuver, so that means failed angioplasty, where blockages are not opened despite best efforts to do so. In this case, bypass surgery is needed. And there is a high risk of bleeding in angioplasty as compared to angiography. Other very rare complications include a risk of heart attack during the angioplasty itself, damage to the artery, abnormal heart rhythms requiring pacemaker. After a successful angioplasty procedure, you will be prescribed blood thinning medications for a long time. And after that, you should limit your smoking and alcohol consumptions to avoid the risk of complications. And it is advisable to stay hydrated in order to flush out the dye from your body. After angioplasty, you generally recover very fast and allowed to go home after stabilization. Keep your doctor updated about the progress and follow up with them regularly as per their advice. Hope today's information will help you clear the myths and prejudices related to angiography and angioplasty.